and you know the risks. So let's talk through some of these common myths that people often ask me about when they're interested in dermal filler treatment, but they're a little bit reluctant to take that next step. So firstly, if I have dermal filler treatment, will I end up looking like a duck if I have lip filler treatment, for example? Or will I end up with that dreaded pillar face if I have fillers in my cheeks? The answer is no, you won't. If your injector knows what they're doing and they understand the planes of your skin, the anatomy and physiology of your face, then that should not be a problem. And also, if they go slow. So really, you shouldn't be having loads and loads of filler injected at any one session. These things take time to build up, and it's best to go slowly so that you can actually start to see the results as your treatment sessions pan out. Secondly, what are the risks? Will I get lots of bruises? Will I get lots of weird dark spots on my face? Will I get an infection? There are lots of risks with any dermal filler treatment. It's a medical procedure and it shouldn't be taken lightly. There is a risk of bruising, particularly in some areas that are highly vascularized, meaning there's lots and lots of little blood vessels. So for example, around the lips. Your lips are pink and red for a reason. There's loads of superficial blood vessels that form that color. And injecting into this area, you're bound to graze or bruise. Graze some of those blood vessels, ending in some bruising. You may also have some swelling, but that tends to die down quite quickly after the injections have stopped. Bruising again will subside within a couple of days. Something that you should be more concerned about is if the area goes very pale or you get little white spots or what looks like a rash. That might indicate a vascular occlusion, a blockage in a blood vessel, and that's a lot more serious. And you definitely need to go back to your injector as soon as you can to make sure that they have a good look at you and can assess the situation. So the risks are there, but as long as you've had a detailed consultation with your injector, see, this isn't scripted. As long as you've had a detailed consultation with your injector, you should be made aware of the risks, and you should also be made aware of how your injector plans to mitigate those risks, so you're not going in blind. And is it a painful procedure having dermal fillers? Well, there is a needle involved, so there will be some discomfort, but the pain, it really depends on your pain threshold. Ideally, you will have at least one injection point wherever you're having the dermal filler treatment. So for example, if you're having it in your lips, depending on whether the injector uses a needle or a cannula, and that is a whole debate for another video, but depending on whether they're using a needle or a cannula, you might have multiple injection points or you might just have the one. Either way, anything sharp going into your skin will cause some discomfort, I'm not going to lie. But most injectors will offer you some numbing cream, and they might even offer you a dental block or a local anesthetic infiltration if you're having treatment done around your mouth. So lip filler, you might even have even more anesthetic that works really quickly and lasts for a while. So that will, it won't completely take away the pain, but it will reduce it to a much more comfortable level. And finally, how much can I get done for 1 ml? I can show you. 1 ml of filler is effectively this very small, very tiny syringe. And if I squirt it out into my hand, this is a recently expired syringe of filler, so I'm quite happy to waste it. You can see what 1 ml looks like. That's it. That's 1 ml. So asking your injector if they can use 1 ml to do your lips, to do your cheeks, to do the tip of your nose, maybe around here, isn't going to work, because that little piddly bit of filler isn't going to cover all those areas that you want to make changes in. So be aware that 1 ml of filler won't go very far. If you want your lips to be very volumized and you've got naturally quite thin lips, you're going to need more than 1 ml, and you're probably going to need more than one session of treatment. So be prepared. It is going to be a long haul. It's not a race. And it's better to go steady and slow so that these incremental changes aren't a massive shock to the system. But also, if anything goes wrong, you're in a much better place to deal with it if you're doing the changes in a very small way. I hope that's been helpful in clearing up some of these common myths around dermal fillers. Watch out for another video in the series where I talk about common myths around anti-wrinkle injections, common myths around acne, common myths around skin aging, whether or not you need to use sunscreen, and pigmentation. If you think of any other topics that